vessels of upper limb. Let's start with the hemodynamics of heart. We have 4 chambers on the right side with deoxygenated blood, on the left with oxygenated blood. The major artery, aorta, rises from the left ventricle. It has 3 parts: ascending arch and descending part. Let's focus on the arch of aorta. It has brachiocephalic trunk, left common carotid, left subclavian. So, this right subclavian artery continues as axillary, which continues as brachial artery. At the level of neck of the radius, brachial artery terminates into radial and ulnar artery. One of the main branches of ulnar artery is common interosseous artery, which gives anterior and posterior interosseous. And the important branch of brachial artery is profunda brachii. So these branches of brachial, radial and ulnar artery forms the anastomosis around elbow joint. In the forearm, the lateral artery, radial artery, descends downwards with the lateral convexity. Similarly, medially we have ulnar artery. Both arteries enters the palm, which gives superficial and deep branch to form superficial and deep palmar arches respectively. And these arches supplies the digits, giving off digital branches. It gives metacarpal branches, perforating arteries. It also gives recurrent artery to the palmar carpal arches. So this is the anterior interosseous artery, which runs in the anterior part of interosseous membrane. Similarly, on the posterior side, posterior interosseous artery. Let's go in detail. First, let's talk about subclavian artery. So this is the principal artery of upper limb, which develops from the 7th segmental artery. On the right side, the subclavian artery is a branch from brachiocephalic trunk. On the left side, from the arch of aorta. The subclavian artery extends from its origin to the outer border of first rib. This is the first rib. In its inner border, we have a tubercle called scalene tubercle, which gives attachment to scalenus anterior muscle. You can see this scalenus anterior separates the subclavian artery into 3 parts. Medial part is first part, behind the muscle second part, laterally it is third part. Let's talk about the branches of subclavian artery. From its first part, it gives a first and foremost branch called vertebral artery. Vertebral artery has 4 parts in its course. The first part, from its origin till it enters the foramen transversorum of 6th cervical vertebra. This first part is present in a triangle called scalenovertebral triangle, bounded laterally by scalenus anterior, medially by longus colli. So the first part is present in scalenovertebral triangle. Now the second part enters the foramen transverse area of 6th cervical vertebra. The artery ascends up till the foramen transverse area of 2nd cervical vertebra, and this will be our second part of vertebral artery in the foramen transverse area of C6 to C2. Then it forms a loop and enters another triangle called suboccipital triangle, which is bounded by superior oblique capitis, inferior oblique capitis, rectus capitis posterior major. Just remember, third part of the vertebral artery is present in the suboccipital triangle. Fourth part enters the foramen magnum to join with the opposite side vertebral artery to form basilar artery. Here let's talk about what is subclavian steal syndrome. So this is the right subclavian artery, left subclavian artery, giving off vertebral arteries on both the sides, and we can see both vertebral arteries anastomose to form basilar artery, and suppose there is a block in the right subclavian artery proximal to the origin of vertebral artery. What happens? The affected arm still receives its blood supply, and also the blood supply increases during exercise or any other physical exertion. How it receives more blood? When the subclavian artery is blocked, it steals the blood from the opposite side vertebral artery at the expense of vertebrobasilar vasculation. Thus results in neurological symptoms. So this is subclavian steal syndrome. So now we have seen about the vertebral artery, its cause, and N1 syndrome. Next comes the internal thoracic artery, which enters into the thoracic region. It descends downwards, runs approximately 2 cm lateral to the lateral border of sternum. Yes, the artery is running near the lateral border of sternum. So at each intercostal spaces, it gives 2 anterior intercostal artery. When it reaches the 6th space, it bifurcates into superior epigastric and musculophrenic arteries. This internal thoracic artery also gives few branches, namely mediastinal artery, pericardiophrenik artery, perforating branches, which are larger in females to supply the mammary gland. So just remember, this internal thoracic artery or internal mammary artery is used as a graft in cardiac surgeries. Just opposite to this internal thoracic artery, we have thyrocervical trunk. This thyrocervical trunk further gives three more branches. One to the thyroid from below, inferior thyroid artery. Another one suprascapular artery. And third branch is transverse cervical artery. This suprascapular and transverse cervical artery takes part in the anastomosis around scapula. So the anastomosis around scapula is formed between suprascapular and transverse cervical artery, which is a branch of thyrocervical trunk from first part of subclavian artery and from the circumflex scapular artery of subscapular, which is from the third part of axillary artery. So just remember, anastomosis around scapula is between first part of subclavian artery and third part of axillary artery. So now let's summarize. Branches from the first part is vertebral artery, internal thoracic artery, and thyrocervical trunk. Again, the thyrocervical trunk gives off inferior thyroid, suprascapular, and transverse cervical. So this is about first part of subclavian artery. Moving on to the second part. Second part gives costocervical trunk. Just remember, this costocervical trunk is a branch of second part of subclavian artery on the right side, whereas on the left side it is from the first part of subclavian artery. So the costocervical branches, as the name tells, costo, it gives superior intercostal artery. Cervical, it gives deep cervical branch. And the third part gives one artery, dorsal scapular artery. Let's move on to the axillary artery. What is the continuation of axillary artery? Subclavian artery continues as axillary artery, and this axillary artery continues as brachial artery. What is the extent? Subclavian artery ends in the outer border of first strip, whereas the axillary artery commences at the outer border of first strip to the lower border of teres major. What is that muscle attached to the cricoid process? Yes, pectoralis minor. So this pectoralis minor divides the axillary artery into three parts. The first part gives a small branch called superior thoracic artery, which supplies the pectoral muscles and thoracic wall. The second part, near the upper border of the muscle pectoralis minor, it gives a branch called acromiothoracic artery. This acromiothoracic artery gives four branches, one towards the clavicle, towards the acromion process, to the deltoid, and to the pectoral region. So the four branches are clavicular, acromial, pectoral, and deltoid. Second part gives one more branch called lateral thoracic artery near the lower border of the muscle. This lateral thoracic artery is larger in females. to supply the mammary gland. And the third part gives subscapular artery, which is the largest branch of axillary artery. This subscapular gives two more branches, circumflex scapular and thoracodorsal. The thoracodorsal artery supplies the latissimus dorsi and serratus anterior. Third part gives two more branches, anterior circumflex humeral and posterior circumflex humeral, which winds around the surgical neck of humerus. So the branches of axillary artery: from the first part, one artery, superior thoracic; from the second part, two arteries, acromiothoracic and lateral thoracic; from third part, three arteries, subscapular, anterior circumflex humeral and posterior circumflex humeral. For continuation, watch next video.